So have the guidelines changed? Because it does seem like the ages are getting a little younger and younger.
Absolutely. So, as of 2026, colon cancer is the number one killer of people under the age of 50,
Really?
men and women. It's the number one cancer right now for people under the age of 50. And that is a scary statistic. And so recently, the USPSTF and the American Cancer Society did reduce the age at which they recommend colon cancer screening. So back in the day, 50 used to be the age, right? Now it's 45. Okay. So 45 is the new 50. Is that low enough? Maybe not, because we're finding younger and younger and younger people. And sometimes they don't even have traditional symptoms of, bleeding or iron deficiency anemia. Sometimes it's as simple as, oh, it's a new change in their bowel habits. And that's what's prompting them to go get evaluated. And sure enough, they have it. So if you are seeing those changes, if you are having a new change in your bowel habits, like let's say you're having a new onset of diarrhea and it wasn't because you got food poisoning and it's not getting better after, home remedies and over the counter stuff for more than 2 weeks, or you had new onset constipation and you're not normally a constipated person and you didn't just take, meds and get anesthesia, it needs to be evaluated. It
And
needs
is
to be
it
discussed.
every 5 years for everybody?
No. So if you are what we call at average risk, which means you have no family history of colon cancer in your family, you have no one else in your family who were found to have polyps, so no other first degree relative like your brother, sister, parent, or child doesn't have any polyps, then you can get it every 10 years. And if nothing was found on the initial colonoscopy. Now, if you underwent a colonoscopy and polyps were found, then the size and the type of polyp itself determines when you need your next one. Okay. And, the guidelines have changed a little bit. Now, if you have 1 to 2 precancerous polyps, which are called adenomas, the repeat is due in 7 to 10 years. Okay. And 3 to 4 polyps, you can get a repeat colonoscopy in 3 to 5 years. More than 5 polyps, if you find that on your colonoscopy, then you need a repeat colonoscopy in 3 years. But if your polyp was more than a centimeter in size, then you need a repeat colonoscopy in 3 years. Just because if you have the genetic predisposition to be making these polyps that grow to this size, then you warrant an evaluation earlier so that we can catch those polyps before they grow to that size and cause more damage and more harm.
Okay. So yeah, mine's every 5 years. I think it's just because of that gene I have.
Yep.
Yeah.
So yeah, again, it can also be because if you have, let's say, a family history. So let's say your parent had colon cancer, then you need to get a colonoscopy 10 years prior to when they were diagnosed with the colon cancer, or at age 40, whichever comes first. Okay. So let's say, God forbid, you had a parent who got colon cancer at age 45, you will need a colonoscopy at age 35. And then every 5 years subsequently, unless they find polyps that, multiple polyps that require an earlier surveillance, but at least every 5 years, even if you found nothing, just because you have that family history of colon cancer or advanced polyps.
And
in
is
your
it just
family.
your parents or maybe your siblings too?
So yeah, so any first degree relative, so that counts as parents, siblings, or even child. So let's say you were just like, I'm going to ignore it, but your adult child went and got a colonoscopy. Yeah, well, that's still technically a first degree relative. And since you were the contributor of those genes, you should get checked.
And do you have an example of how a colonoscopy saved someone's life?
Ooh. I would like to have said that I haven't, but in the last 5 years, I have seen more young people who were dismissed for their symptoms and turned out it was colon cancer. And I will give you an example. I had a 36-year-old woman, a 6-pack Pilates instructor, super healthy, did everything right? Ate well, ate clean, meditated, exercised, all of it. And the only thing is she was adopted. She didn't know her family history. So she came in because she's like, I'm bloated and I'm constipated, but all I do is eat, healthy, fiber, kale salads, everything. And she's like, I move every day. And like, this is not normal. And I was like, okay, but have you seen any blood from your stool? She's like, maybe once, a couple of dots on wiping. Yeah. Let me not assume that was hemorrhoids. I'm so happy I did her colonoscopy. She had what we call an apple core lesion, where it was so large that it was basically causing a blockage. And there was basically a tiny little hole allowing for that poop to seep out. That's the only reason she was having bowel movements. She's like, why am I so constipated? Because there's a near obstructing lesion that's basically preventing poop from coming out.
You said she was 18?
No, 36.
Oh, okay. 36 years old.
Yeah, God, 18 would make me that'd be terrible. But either way, I mean,
Yeah,
young
that's
is young.
so young.
So young. Super healthy.
So what was that like for you when you had to give her the results?
I have yet to not be emotional about it because one, I'm getting to that age, right? I'm getting to that age. I'm like, oh my God, could this be me? Because, it's heartbreaking. I had another woman who's a fellow physician and she had just given birth. And she's like, are these just hemorrhoids from me having given birth? I'm like, maybe, but why don't we just check? Colon cancer. So one, it's a sobering, statistic where you're like, wow, this could be me. And two, these are people younger than me, right? When I was a young fellow, I was like, oh, this is an older person's disease.
Uh-huh.
It wasn't that old, but it was an older person's disease. And now I'm getting to that age where my peers are getting it.
Mm-hmm.
And now people younger than me are getting it. And so
Mm-hmm.
it's a sobering statistic. And it's also one where it makes you realize that like life is not discriminatory of anyone, right? Physician, non-physician, rich, poor, healthy, not healthy, all these things. And so health is wealth. Health is wealth.
Did she survive?
Yes.
Amazing.
Thankfully, because she got that
Mhm.
colonoscopy, we were able to, we do something called a tattoo where we place ink at the end of one end of the tumor and ink on the other end of it. So we can kind of demarcate where the surgeon needs to go and take out that area. She got something called a hemicolectomy, which means that she got basically half of her colon removed, and then they can attach a portion of the small bowel or even the large bowel and then put it to the rectum and then kind of reattach and make the healthy parts of your bowel. But she got a hemicolectomy and she's doing well.
Amazing.
And
Thank God
she's
she
got
came to see
chemotherapy.
you.
Oh, I mean, I could not be happier
Mhm.
in my decision to do her colonoscopy.
Yeah, because you could have looked at her at her
Like,
age,
yeah.
the situation.
Yeah, and I was like, you look healthy. You're probably just bloated. You're probably just constipated. Like,
Mhm.
eat more fiber.
Right. But
God.
just in case,
Yeah.
let's get this done. Good
Yeah.
for you.
Yeah.
Amazing.
And I'm really happy that I didn't ignore or dismiss her symptoms, which I feel like happens a lot where even I see a lot of irritable bowel syndrome patients, like IBS patients, and a lot of them get dismissed like, oh, maybe it's because you're anxious, you're stressed, you're not eating enough fiber. Yeah, but what about for the people that are? What about if you're still doing something right? It warrants a second, look.
Mhm.
And that's where I want people to take their symptoms seriously. And if they're not finding a doctor who will take them seriously, to find a doctor
Mhm.
who will.
Yeah, I think that's key is finding the right doctor.
Correct.
Because unfortunately, and this is with any field, there's certain doctors, they just dismiss you and you're just another number.
Yep.
And there's the other ones that take
Yep.
their time, just like you did with this specific patient. And you got to keep looking.
Yep.
You have to be your own self advocate.
Absolutely. Absolutely. Because the only person who knows your body best is you,
Mhm.
right? And you're hopefully as in tune to what's happening to it more than anybody
Right.
else. So if you have a hunch, a gut feeling,
Go with
go
it.
with it. 100% go with it. There's
No-
a reason why you
No
have it.
pun intended.